Okay, so let's continue today's classes. And today we're going to look at four things. We're going to talk about pharmacopoeia. We're going to talk about steps in compounding. We'll then talk about labeling requirements, and we'll end the class with safety standards. All of these, like you know, are all related to non-sterile product compounding. So, pharmacopoeia, I think I mentioned something about pharmacopoeia in the last class when we were about to close, and I said that pharmacopoeia is like the Bible or the Quran of the pharmacy practice. It's actually an official publication that contains standards for medicines and pharmaceutical substances. So it's an official publication that countries keep, not every country, but countries that have advanced in pharmaceutical industry actually keep this to ensure that standards are maintained over the years as products are being manufactured, produced, compounded, and all of that. So pharmacopoeia, I mean, you can't be in this space of practice without knowing what the pharmacopoeia is and what it does to the profession. So like I said, if you must remember anything about pharmacopoeia, remember that it's an official publication that contains standards for medicines and pharmaceutical substances. And I did mention that the two most popular pharmacopoeias around the world are the British pharmacopoeia and the United States pharmacopoeia. There are others. There are European pharmacopoeia. In Nigeria, we have our own version of what a pharmacopoeia is not a full-blown pharmacopoeia. They call them national formularies. We have all of that. But most of the countries of the world align with either using the British pharmacopoeia or the United States pharmacopoeia because they've been in existence for a long time and it keeps getting updated from time to time. So it's an official publication. I've just put the picture is what you're seeing on your screen. And this is how the book is. Of course, as you can imagine, to be in volumes. You can't have all the medicines that have been produced, the standards in one document from 1820, and it's still a single book. So they're in volumes. For whatever medicines you're looking for, you'll find them in the pharmacopoeia. So what do we use the pharmacopoeia for? They are the authoritative reference for quality specification. And quality specification is identified by the identity of the particular preparation, medicine or preparation, the strength and the purity, So is the official authoritative reference for quality specifications, is specific things that must be contained in that preparation. For you to call it paracetamol, it must have this in this quantity for adults and this for children and all of that. And these are the ingredients that you must have. It's also like the authoritative reference for preparation and storage requirements, and also for analytical methods for testing. So the pharmacopoeia provides for you to test, to take a medicine that has been prepared following the standards and guidelines of pharmacopoeia and be tested in a way that confirms if this is fake, this is genuine, just to confirm that this preparation is okay or not, and that's why we have NAFDAC. If you remember NAFDAC, part of what they do is to ensure that we have quality medicines being produced in the country, all of that regulation in place. So NAFDACs have laboratories where they can test, they can pick up a commodity, a medicine, and go to lab and test and say this batch that you have produced or these things you're selling are not genuine. Or they confirm that according to British Pharmacopoeia preparation or US Pharmacopoeia, these are the standards. So, when you do testing, you want to check uniformity, testing, things like safety and efficacy. Efficacy is how potent that medication is, how the medicines are able to, elicit the effect that they're intended for. So a bit about British Pharmacopoeia, and I started mentioning in the last class, is that it was first published in the UK in 1864, the very first set of pharmacopoeia, like the British Pharmacopoeia in 1864. The American one was even earlier, 1820. Well, British Pharmacopoeia was first published in 1864, and it's been published fairly annually since then. There's a body responsible for pharmacopoeia in the UK. It's called Medicines and Healthcare Product Regulatory Agency, MHRA. In the UK, they're the ones responsible for ensuring that the pharmacopoeia is updated, published, and is in use in the UK. They have, lots of pages containing active ingredients, excipients, formulations, even herbal medicines have now been included in pharmacopoeia. You'll find preparations for approved herbal medicines. Like if in Nigeria, if NAFDAC approves that herbal medicine to be in circulation, you should find them in the national formulary that we have. And so British Pharmacopoeia now has sections for herbal medicines. Yeah, so analytical methods are mentioned, and it's a legal requirement in the UK that if you're in the manufacturing of medicine, you must comply with the British Pharmacopoeia. So in the UK is a must if you're in the manufacturing. Other countries in Asia, Africa, we've all adopted the use of British Pharmacopoeia, and in some cases, US Pharmacopoeia. So for whatever preparation you make, in your leaflet, that information document that you insert in drug, you must say, what standards you're using to prepare the medication, so that if there's a need for testing, the person is saying, okay, let's test it according to how it's in the British Pharmacopoeia. So that's a quick summary of what the British Pharmacopoeia stands for. So similarly, for United States Pharmacopoeia, 1820, I've mentioned, started by a group of doctors in Washington, D.C. They started publishing in 1820. And in the US, the body responsible for pharmacopoeia, for managing the pharmacopoeia, it's the Food, Drug, and Cosmetic body. And so it's called United States Pharmacopoeia Convention. They're the ones that are responsible for ensuring that the document is continuously being published and maintains the standard. Just like the British Pharmacopoeia, it has everything, including, quality assurance processes, all standards, detailed procedures for analytical testing and all of that. You have that all in the United States Pharmacopoeia. Okay, yeah, I said that there's the enforcement for standard for United States Pharmacopoeia in the US is the Food and Drug Department of the US. Why does pharmacopoeia matter in compounding? I mentioned that it provides official reference standards for ingredients used in compounding. Active pharmaceutical ingredients and excipients must be according to the grade that is prescribed in the document, and it must come with what is called a certificate on an analysis. For every commodity, every medication that is being prepared must have a certificate of analysis to say that it's been tested, to say it contains the right thing. It helps to ensure compound products are safe, effective, and reproducible, so that if you're in the business and you're manufacturing and distributing, you want to make sure that all the medications can be reproduced in the exact same way, and we have them in the exact same way in different countries. Keep the standards across countries, not to ensure that some drugs that go to some continents are different from the others. Ensure that standards are kept. And it also facilitates international trade, and harmonization of drug quality. It enhances that if people are sure that you're using the right standards to manufacture, then it's guaranteed. That's why you hear, there are things about drugs, for instance, manufactured in India or in China. Sometimes there are rooms for manufacturers of substandards, but if it's in the UK or US, the regulatory authorities are very firm to ensuring that you use all of this. In China or India, people could just go from here and just begin to manufacture a line. My name is Kolo. I can go and manufacture colomycin. You can go to companies there and say manufacture this for me, put my name and all of that. But in the UK and US, the processes are stringent. It's not easy to do that. And so they maintain standards. If you want to be a manufacturer in those countries, the processes and standards are very, very tough. Okay, so that's it about pharmacopoeia, just to expose you to the fact that really, there are documents that makes life easy. You don't have to crack your brain to start to say, I want to manufacture this. Everything is there. You just open it, keep it, and follow every standard in compounding or manufacturing, or production of medicines. So I'll pause and see if anyone has any question on our discussion of pharmacopoeia. Any questions? If there are no questions, give me thumbs up so that I know that I continue. Somebody thumbs up, let's continue. If there are questions, raise your hand. Use the raise your hand emoji, and then let's ask questions. Let's continue. Okay, that's the question, right? Yes, please carry on. Carry on with your question. It's like you raised your hand. Okay, okay, Rachel, thank you. Saw your thumbs up. This Fam, is it Fam Idris? Abdulrazak Bello. Your hand is up. Is that a raised
Yes,
hand?
sir. It is me, sir.
Okay. Yes, please ask your question.
Yes, of course.
Thank you, Rose.
Thank you, sir. Regarding
Carry
to
on.
the pharmacopoeia. Yes, sir. Regarding to the pharmacopoeia, you talk about the pharmacopoeia, and I need more highlights on it, especially API, active pharmaceutical ingredient that I hear you talk about.
Yes. You want highlight? I should throw more light on
Yes,
active pharmaceutical ingredient,
yes, sir. Yes, sir.
or you want me to throw more light on active pharmaceutical ingredients? Okay. So
Yes,
in
sir.
the last class, all right. Thank you, Abdul. In the last class, you were, I don't remember seeing you in the last class, but we discussed about compounding ingredients. And I mentioned that for every pharmaceutical preparation, there are basically three major components you would find. You will find active pharmaceutical ingredient, that is the active substance that is responsible for the pharmacological action or therapeutic action. That if you have a headache and you want the headache to go, so you take paracetamol. There's something in that preparation, the tablet that you're taking, or if it's a
Okay.
syrup for a child, there's something you're taking that has the active ingredient to go and, using its mechanism of action, stop the headache from happening. If it's too much pressure of, whatever cluster headache or kind of, there's something that is active in that preparation that will cause that effect or cause that change, that headache to stop. That's what is called an active pharmaceutical ingredient. So for paracetamol, for example, acetaminophen, the active ingredient is acetaminophen. You know, it to be in a preparation that contains excipients, and we mentioned the other day that excipients could be diluents, which could be like starch. We call them in pharmacy bulk forming agents. They are the things that carry the active ingredient. So if it's a tablet, it could be starch or lactose or something that you put the active ingredient in it. So that's a diluent. And then there could be a stabilizer, something to ensure that the drug is stable, not disintegrate easily, maybe under sunlight or small moisture or something. Then there could be preservatives, something to prevent, suppress the growth of microbes if there's that condition for it to. So there are active pharmaceutical ingredients, there are excipients, and then there are vehicles. Vehicles, for example, if it's a liquid preparation like syrups, you will have all of these active pharmaceutical ingredients, excipients, diluents, stabilizers, preservatives will have to be in a liquid that will carry everything, and they must be compatible with all of these active, um, pharmaceutical ingredients. So the summary is that an active pharmaceutical ingredient, it's that particular thing that causes the change, the therapeutic effect that is contained in the medicine. So if you see any medication, you should know that there's something in that. Whatever medication, amoxicillin, for example, the active pharmaceutical ingredient there, amoxicillin, it contains other things. You know, that's why you see amoxicillin, for example, you hear amoxicillin trihydrate. The active pharmaceutical ingredient will be there, and then there are other things involved. So the active pharmaceutical ingredient is the one that causes that therapeutic change or effect. Are we clear now? Are we on the same page? Abdul Malik, we're on the same page? Okay, I see your hand still raised up, but I think I'll continue. I will assume you are clear, and then we'll continue. Do you still have any questions on that, or should I go ahead, Abdul Malik? Abdurazak, sorry. Okay, if you're speaking, I can't hear you. Let me continue. Okay, so next slide. Um, IT, next slide. Good. So the next thing we're going to be discussing now is steps in compounding. Of course, non-sterile product compounding is what we're talking about. We've not come to sterile product compounding yet. So steps in compounding, and these 6 steps as shown on the screen are the steps to follow in any non-sterile product compounding. I remember in the last class of Dr. Blessing that I joined, she did also mention that one of the things to do at the beginning of any pharmaceutical process, is to review a prescription. A prescription will come. So whether you're dispensing, she was talking about dispensing, whether you're dispensing or compounding, the first thing to do is to review a prescription, which means that the assumption is that whoever is in that space, be you a pharmacist or a pharmacy technician, you would have a basic knowledge of what a prescription will look like. That when you receive them, you're able to tell that, oh, this is complete. This prescription is complete. Makes sense, and I can go ahead. And I remember she saying you check the completeness of, first of all, the name of the person presenting, to be sure it's the person. If it's not the person, why is the person presenting on behalf of another person? You do all of that, clear that, and ensure that that's okay. And then you check that the prescription is complete, accurate, and clinically appropriate. Generally, we know, if you are in the practice, you will know what ingredients should not be in the same preparation with what ingredients. Over time, you get to know. It comes with the practice anyway. So once you receive a prescription, the first thing to do is to check the prescription generally. Is it complete? Is it accurate in the way it's being prescribed? Clinically appropriate for whatever intention that medication is meant for. You just check all of this. Confirm patient details, of course. Important things to confirm on patients is name, age, weight, diagnosis, and allergies. Really important to confirm if the person is allergic to certain ingredients prescribed as you will find in the prescription. So you check the person's name, check the person's age, check the person's weight if they are all on the prescription. For a compounding prescription, it should come with all of that. Check the diagnosis. What is this intended for? If they're saying that this person is trying to treat a headache and you're seeing a medication that is not meant for headache, you should question it, or return it to the doctor that is prescribing the medication. Right, prescribing the medication. So, and then you ensure that the requested medication, strength, dosage form, and routes of administration are suitable for the patient. Simply means if a compounding prescription comes to you and this person is a child and the person and he's saying 2 capsules 3 times a day to compound this into a capsule, you know that the person is 2 years old, swallowing capsule will be a problem, all of that kind of things. You look at the route of administration and be sure that you're okay with that. Very important to look out for is drug interaction. Again, I mentioned allergies and contraindication. Generally, there are certain things that are contraindicated. You know, for example, if the person is pregnant, there are certain things the person should not be taking in pregnancies and things like that. Check for allergies. There are some people I know when they take Satrin, for example, they react to it, something called Steve Johnson syndrome. Find out all of that to be sure that you are completely making sure that patient safety is a priority. An example of this is if a pediatric prescription requires the formulation of a drug that is only available as a tablet. Compounding may be needed to prepare a child-friendly dosage form, or maybe the flavor should be something that will encourage the child to want to take and all of that. So that's the first thing you do when you receive a prescription for compounding any medication. Check all the completeness, interaction, contraindication, and make sure you clear all of that. Then what's the next thing? Next thing is to perform the calculations. Because once you're compounding, it means that the, either two things are happening. Either you're taking from raw materials and putting them together to prepare something for someone specifically, or you're even taking from already prepared, like a medication. You're supposed to take maybe a paracetamol tablet, break half, crush it, and then prepare something. But in most cases, maybe the prescription will come and there are raw materials in your compounding room that you need to put together to make that medication. So just perform very simple calculations. Calculations could go in compounding from simple to very complex calculation, depending on what you're preparing. And I think I saw that there will be a course on pharmaceutical calculations. Students confirmed this to me. Are you doing a course on pharmaceutical calculations? I think I saw one of the
Yes,
courses
sir.
on pharmaceutical calculations.
Yes, sir.
All
Yes,
right,
sir.
great. Great. So I really don't have to go through all of the calculations I had put down. I put a few calculations for us to go through just in case you have not started or if you're not doing anything on pharmaceutical calculation. So I won't have to go into that just so that we're all on the same page. But after reviewing the prescription, you will have to perform. There's hardly any compounding you do that you will not do some basic calculations. Could be like I said, from basic to complex. So you're going to check for the accuracy of the amount of active ingredients, active pharmaceutical ingredient and excipients required, and you can do that simply by confirming from your pharmacopoeia. If you're in doubt of anything, please check the pharmacopoeia. Then double check the concentrations, make sure that sometimes there could be some conversions in the calculations before you go ahead to compound. There, make sure you're careful about errors in calculations. They're among the most common issues you find in compounding. Errors pharmaceutical active pharmaceutical ingredients can change, can give you a completely different intended consequence if you miss the dosage, if it's lower than that or higher than that. I give you an example with aspirin. You all know aspirin. Aspirin in the past used to be the common medication for treatment of headaches and pains. So at 150 milligram, aspirin will treat for you the headaches and pains you have. Specifically, if you have toothache in those days, it's really prescribed for toothache. At 150 milligram, it will give you that effect. But if you want to use aspirin for something different, use 75 milligram. It will help a situation where you have clotting of blood. If they want the blood clotting to be, to be liquefied, 75 milligram aspirin can do that. So I'm saying that same medication, different strengths can have different consequences. So it's important that there's no error in your calculation at all. It's important there's no error in calculation, because so that you don't go and treat something else for something else. That's the point. And then always use an independent, verification. Either you self-check again after your calculation, or you have a peer, somebody that you're working with, check it to be sure, so that there won't be any errors. In the next few slides, if IT will mix, we'll go down a few slides and come back. IT, if you go down the next slide, I had put just a few things about pharmaceutical calculation. Again, I won't have to go through this because I know you're doing a course on this. But I just wanted to go through very simple calculations that you come across when you compound. Like, yeah, yeah. So let's just take that first one. Go back to that first one. Let's just take that first one, and then, you know, um, IT, go back to that first one. Let us take that first one. I, oh, okay, let's stay with this one. If Are you seeing the slide I'm seeing is converting milligram to milligram per mil to percentage? Is that what you're all seeing? Simple calculation, and I am milligram per mil. That means 25 milligram in 1 mil. You weigh 25 milligram of a powder of an ingredient, and you put it in just 1 mil of water. You, you've gone back. Can you go back? We started with that one. Can you go to the next? Can you go to the next one? Now we started. Let's just finish with that one. All right. Yes. Uh-oh. No. The next one. Okay. Just stop at this. Let's just use anyone we have before us. Stop at this. Okay. So let's use this example. Example one. A vial. You know, a vial is that small thick bottle that contains powder. A, that small thick bottle that contains vial. So they say a vial contains 500 milligram of a drug in 10 mils. So the vial has 500 milligram of the drug, put 10 mils, they put it in 10 mils of, of a vehicle, of something, 10 mils. And they are asking the question, what is the concentration? 500 milligram in 10 mils. So in essence, for this example, what we're trying to find out is what is the concentration is asking. When they say concentration, we're asking for what is contained in just 1 mil. Remember that the mils of water here is 10 mils containing 500 milligram. What do we have in 1 mil to tell you what the concentration is? So if we have 500 milligram in 10 mils, how many milligrams will we have in just one single meal? That's dividing 500 by 10, right? Which gives us 50 milligram per meal. So the concentration of that drug is 50 milligram per meal. So note that when the prescription for compounding comes, it will not always come in the very last concentration for you. It might come in this form. It might just come as they give compounded drug that will have 50 milligram per mil, but what you have that you're taking from and doing the compounding comes in 500 milligram in 10 minutes. So you are the one who will now do the calculation and be sure that it's 50 milligram in 1 meal. And so if they are telling you, oh, it's not 10 meals that they want you to put in the bottle, it's just a 5 meal, you have to do all of that conversion, knowing that it's just 50 milligram in 1 meal. So you have to know how many milligrams we'll have in 5 meals, like that. So I just wanted to bring this up and say you would always come across calculations. I'm sure you're handling it in one of the courses, and you need to take your time to really understand the calculations of conversions from percentage to concentration, milligram to milligram per mil, and all of that. I hope you pay a lot of attention to that because that is critical to every compounding process. Yeah, so let's go back to our slide. Let's go back to our slide on steps compounding. Let's go back to our slide on steps to compounding. Good, thank you. So after you've reviewed prescription, you've performed your calculations, the next thing is to go ahead with your measurements, weigh the ingredients and begin to um, make sure you're getting the right weight. You've done the calculation, so you know what weight you're going to measure. If it's liquid, you know what liquid you're going to be measured. So use the calibrated balances. We talked about electronic balance and touch run balance, depending on what's available. If it's for smaller quantities, for very fine quantities, smaller quantities, you want to use an electronic balance. But for very heavy, you might use touch run balances to weigh that. But do the weighing. For liquids, use the you know, uh, appropriate equipment or material to use. Pipettes for small quantities, syringes sometimes, and then for bigger quantities, graduated cylinders. Remember, we have cylinders like you see in the lab, big cylinders to measure your 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 liquids. For solid, use balances to weigh. For liquids, measure small quantity, you need pipettes. If it's slightly medium quantity, syringes. If it's bigger, graduated cylinders. Make sure that everything is weighed carefully. Right. So all the measurements are correct. You go to the stage of mixing and blending appropriately. I'm sure you have the opportunity during your internship. You will have an opportunity to do some compounding. So the next step will be um, you know, mixing and blending appropriately. There are different techniques to doing this mixing and blending. Different techniques. Sometimes it could be just some dilution, mixing of powder for different strengths. So sometimes you have two, three different powders you're mixing, but in different strengths. This one is coming in this strength, this one is coming, but you need to mix them together. So there's some form of dilution and geometric dilution you do. Some other ones are reducing particle size before you put them into, like an ointment or any medication like that. They call that levigation. And then there's trituration. Trituration is also breaking bigger particles in powder form and making sure they blend together. And for more advanced systems and processes, there's homogenization. So again, all of these tools and equipment will exist for you in the laboratory, but make sure the mixing is appropriately done all the time to make sure you're having the right concentrations and uniformity, ensure uniform distribution of the ingredients in the medication. And then after mixing all of that, you have your medication. And I remember in the days of my university days, when we do compounding or any preparation, if you are preparing emulsions, that you mix this, mix that, follow the pharmacopoeia, mix this, mix that. Before you stop the mixing, you must hear a click sound. So if you continue to mix, emulsions are some, either powder mixed with some oils, and you continue to mix them. There's always our lecturers there will stand by you when you're doing it with their paper waiting to grade you. For that emulsion to be perfect and uniformly distributed, there will be click sound at some point. If you're mixing, you come to a point where you hear click in the process of mixing, then your product is fine. Then you can say you've uniformly distributed everything and all of that. You have the experience, I'm sure, if you have the opportunity to do your internship. So when products are ready, the next thing to do is to package and label. Packaging and label. Select the appropriate packaging materials, you know, for the particular product. Some products are not good when you expose them to light, too much light. So there are some bottles that are called amber bottles. They can help with managing light. They are not like the transparent, completely transparent, colorless bottles that light can pass through easily. So, like for light sensitive products, you have to ensure that you're using amber bottles and things like that. Just selecting the appropriate packaging is one important process in compounding. Packaging that will ensure convenience, safety, sometimes child resistant cap, something like child cannot easily just take and open. And then the last part where you finish is documentation and quality check. Whatever product you have produced, you must make sure you are certainly you have to make sure that you document them. In the lab, there will be a logbook for compounding. You state who did you compound it for, age, name, all of that will be there. You just fill the logbook to be sure that you're keeping record. In case there's a problem, you'll come back to it to be sure where did the error happen or something. So documentation is really, really important. And then in the end, do your visual inspection to be sure the color is fine, texture, just, is visual measurement. I say you should never do. But, when you're done, you have to look at the program and say, this looks good and all of that. In some cases, there will be a need for you to do some quality checks. From what you've prepared, take a few, and just do some quality checks before it is rolled out into to the person that will use them. So these are steps in compounding. Steps in compounding. Let's go to the next one. After all the calculations, there's labeling requirements. We have 50 more minutes. In the next 5 or so minutes, let's go through labeling requirements and um, labeling requirements and safety standards. Then we end. So for labeling requirements, um, depending on the product, what you're producing, you again remember that for every product that you compound, you're compounding for a specific patient, not like when products are manufactured and are taken out, sold, or distributed. You wouldn't know who you're making the product for at that point of making. But for compounded products, you're doing it for a particular person for a particular cause. So patient name and ID on the labeling paper, patient name and ID, drug name, generic preferred, not Panadol, not Emzomol. Put the actual generic name, paracetamol, not use brand names, use generic names so that everywhere it's recognized as the same commodity. Then strength must be put. Also, you have to mention it's 500 milligram per mil or whatever strength of 500 milligram, just milligram and things like that. And the route of administration should also be there. This is to be taken orally, or this is to be injected, and all of that. And then direction for use, that direction, the right one, 3 times. You also have to put that one on the labeling paper or container. Take 1 teaspoonful by mouth. All of that must be really clear. Then expiry date. Expiry date must also be quite clear. You must put that expiry date on that product you compounded. And then storage instructions, room temperature, or shake well before use, or use before meal, or use with meal, and all of that. And yeah, so that's about labeling requirements. The last slide on safety standards. Yes. So on safety standards, our last slide on safety standard is to ensure that safety is critical in compounding. We want to protect the patient, even the pharmacist or technician. You want to protect yourself, and you want to make sure that the environment is safe. Really important. Hand washing, use of personal protective equipment, and ensuring the clean workspace. Don't eat food on the same table you're using to compound, or put other things that are not related to the compounding on the table. Just, make sure you're using a hairnet whenever you're compounding, so that the hair is covered. You're using your lab coats, face masks where necessary, and all of that. So
PPT,
hygiene. Sorry, someone
PPE.
speaking. PPE,
You are saying something?
personal
Yes,
protective
sir.
personal
Yeah, yes, sir.
protective equipment. Yes,
Yes,
personal
sir.
protective equipment. Yes, thank you. You remember during COVID, those things that people wear, the white things that cover your head, your face, your nose,
Yes.
and your entire body, including down to the shoes. Yeah, these are PPE. So depending on what is required, you have to make sure you are using your PPEs as well. Yeah. All right. And then uh, prevent cross contamination is really important. To prevent cross contamination, you know, use separate equipment for hazardous and non-hazardous, components. If there's things that are hazardous, please don't use the same thing to measure or fetch them. Make sure you're measuring them separately. Dedicated compounding area to specific tasks. If you're measuring, let the measurement happen in this part. If you're doing weighing of liquids, let it happen on this part. Just make sure you compartmentalize your compounding table to just avoid anything that will cause cross contamination from one point to another. Clean and disinfect the work area regularly to ensure that we're not ensuring any cross contamination. Then special handling for hazardous drugs. There are some, drugs that require safety cabinets within your compounding area. Some drugs are kept there because you use little quantities, and those quantities, there are some drugs that are called cytotoxics. When you put them more than the concentration, they can affect the cells, the cells that you're taking them to ensure pharmaceutical effects. So we just make sure that we're handling hazardous uh, chemicals or drugs very well, and ensure a closed system for them all the time. And proper waste disposal is really good. Whatever you use, you're not going to use again, dispose properly. Detailed documentation, we mentioned that is really important to document everything very well. It's a safety measure in your compounding. Make sure the documentation is done very well. Then regular staff training and competency check. There will always be either your peers or your supervisor. Ensure that you're ensuring that you're constantly in touch with others, what they are doing, and ensuring that somebody is overseeing what you're doing before it's rolled out. It's just important that you submit yourself to some peer checks and support in the process of compounding. And then don't forget to comply with the pharmacopoeias, the standards in everything you do. So that's the end of that slide. Yeah, so that's it for this class. I will leave the next 7 or 8 minutes for any questions or comments before the class ends. Thank you. Any questions or comments? We have 8 minutes more.
Hello, good evening, sir.
Good
Good
evening.
evening, sir.
Yeah, Nwipoka, good evening. I can hear
Hello,
you. Go ahead. Yes, go
evening,
ahead,
sir.
Nwipoka. Yeah, good evening.
Please, what is hazardous? What is hazardous?
Hazard.
Mhm.
Okay, all right.
Can you hear me, sir?
Hazardous. Yes, I can hear you. Can you hear
Yes.
me? So hazardous, just like the word
I can hear
hazard.
you, sir.
These are okay, right. So hazardous simply means that some of the chemicals or ingredients or excipients or active ingredients you're going to be using would have really serious effects that are not intended. So when something is hazard, something that can cause injury or damage, so for
Uncle.
example, I'll give you an example. If you take antibiotics, if you overdose on antibiotics, any antibiotic that chlorphenicol, amoxicillin, and all of that, you may not have much problems if you overuse antibiotics, but there are certain drugs that more than the prescribed quantity, they become hazardous to you. In fact, some of them can cause heart in cases of treatment for heart conditions. Normally the concentration for adults is 0.5 milligram. If you mistakenly put more than that, it could become a lot of respiratory systems and all that. So hazardous simply means something that you must handle very well, because if you put too much of or go outside the prescription, it will be hazard. It will cause a problem to the organ you're trying to treat, or the particular intended effect will be the opposite.
Okay, sir.
Are you fine? Okay, yeah. All right. So Ariza, I saw your hand up.
No, okay, I was trying to refer to the drug, another drug, PHT.
Okay, you wanted to ask about the same hazardous, right?
So I was just trying to keep in what you were saying about dangerous drug.
Okay, all right. Okay, thank you. If you want to throw more light on hazardous drug, please go ahead.
Okay, yesterday we were talking about the dangers of using codeine.
Okay, yeah, good. Good example. Very good example. Codeine. People abuse
Network.
codeine these days. All right. People abuse codeines, and it can be hazardous to your, if you don't use it for the intended purpose, it can become hazardous to you. So also there are active ingredients or excipients that you must use with care. Otherwise, they become a problem. Some others, if you mistakenly put more, they will not be too much problem. But for some, it's really a big issue. So you have to be careful in your calculations and in handling of all of the ingredients you use in compounding. Thank you very much. It's been an engaging and exciting class today. Let's speak up more. It's very encouraging when you speak up. Thank you so much. That will be the end if there are no more questions. That will be the end of our class. We'll have a fourth and final class on this course next week. God's
Thank
willing.
you, sir. Thank you, sir.
Thank you so much. All right. Have a good evening.